How long does therapy take? There are two sides to this question. One is that some people have been suffering in pain and frustration and trauma symptoms for so long that they really want to know, how long is this going to take to feel relief? And then the other side is more long-term, big picture. How long is it going to take until I don't need to come and talk about this anymore? How long until things are resolved? So I mainly work with EMDR, eye movement desensitization, and reprocessing therapy. The thing about EMDR is that you can get some rapid relief even in the first session for some people. We start by teaching grounding skills, which really helps you to stay present with your emotions, and it really helps you regulate your emotions. The processing takes time. We're going to reprocess those negative thoughts into more positive, helpful thoughts. So that's not going to happen overnight, but it can actually happen pretty quickly compared to other therapies, which leads to the second question, really, like, how long am I going to have to stay in therapy going through this stuff? Like, okay, my symptoms have kind of gone down, they've calmed down, I can handle life now, but how long am I going to have to keep talking about these things? I don't believe in keeping people in therapy really long term. And I know sometimes people will say they've had a therapist for 2 years, 5 years. I got to be honest, that kind of makes me cringe a little bit, because if you have a therapist for 5 years and you're still struggling with the same problems, you might not have a good match. You might not have somebody who really knows how to help you overcome those issues. My clients start seeing relief to their symptoms within one, sometimes even one session, to like maybe 3 or 4 sessions. There's some relief that comes, and then we start processing and going through the memories and the traumas and helping you make sense of them. And obviously I can't guarantee any results, but this is just what I'm seeing from the data that I've collected. When we talk about EMDR and we talk about clearing a target, what that means is you can think of a memory or a traumatic situation and you feel no distress. You feel neutral. It doesn't bother you at all when you think about it. When you talk about it, you don't feel emotionally charged. You don't feel activated inside. So the first step to EMDR is bringing you to that point where you can talk about it, where you don't feel emotionally distressed. And then the second part is that you actually have a positive belief about yourself. You can talk about that memory and say to yourself, I am enough. I am lovable. So step 1 is having no distress. Step 2 is being able to believe something positive about yourself when you think of that memory. And then the final part is that there's no physical activation in your body when you're thinking of that memory. You're thinking something positive, and if there's anything that you feel physically, it's positive feelings. That is clearing a target in EMDR. And there is some prep work. We do have some sessions leading up to actually starting the processing, because I need to know that you can handle your emotions, and we need to talk about what it is that you want to process with EMDR. Once we have the target picked, and once we have the skills built up where you are comfortable and confident in your ability to regulate emotionally when you feel activated, then I actually have had some people clear a target in one 1-hour session. And then I've had other people take up to 12 or 13 sessions to clear a target. That's going to depend on the kind of target that we're doing, how traumatic it is to you, how distressing it is when we first start. And it's also going to depend on the way that your brain processes. So I can't make any promises, but those are the stats that I see. Then once we clear a target, we get to look at what it is that you want to continue processing. And maybe I bring up stuff that you talked about in our intake, and you're like, you know what, that doesn't bother me anymore. I'm actually not affected by that anymore. And that happens all the time with my clients, because we're not just processing a memory, we're processing a negative thought, and we're helping you think differently about yourself. When you think differently about yourself, then that can actually change a whole bunch of memories, and it can change the way you see your entire past. Sometimes people say, you know what, it is bothering me a little bit, but it's nothing I need to stay in therapy for anymore. So some people will stay very short term. They just want to do 1 or 2 targets, and then they go and they live their life and they're fine. Sometimes those people come back later and say, I'm ready to process this other target. Sometimes they don't ever come back and they're just completely fine. And then other people, once they clear one target, they're really excited and they want to just clear everything. So they're like, well, let's do this one now. And then we clear that. And they're like, well, let's do this one now. But therapy is never about keeping you trapped in therapy. I want to do what's best for you. So the moment that you start to reach your goals, we start to discuss, does it make sense to go down to bi-weekly or even monthly check-ins? Or do you just want to complete and come back when you need me? My goal is to help you heal, because healed clients make a difference in the world and people notice. And honestly, people ask, what happened to you? How come you're so different now? And that is the greatest compliment that I can get as a therapist, is to have somebody say, I went to therapy and here's my therapist's information because she really helps me. And it's the goal of my work to help people. I just want to help people get healthier mentally, feel better, and relieve themselves of the burden that they have carried for so long.